to talk a little bit about ORCA, which is the Olympic Reporting Community Activities. That is our online platform for all things MTP or Medicaid Transformation Project. We'll then talk about scheduling the one-on-one meetings that myself and our clinical transformation manager, Juri Jun, are available for. And Maggie then can talk a little bit about contracts and payment. And then the last 30 minutes, like I said, will be reserved for the Q&A. So a little bit of history, we want to talk about and get everybody on the same page on what is Medicaid transformation. It is a 5-year agreement that runs from 2017 through 2021 between the state or the healthcare authority and the Centers for Medicaid and Medicare Services, or CMS. And that provided up to $1.5 billion federal investment to help transform projects in our state that impact Medicaid clients. The main goals of MTP are to improve the overall health of the population for our region. And our region, for those of you who don't know, is Clallam, Jefferson, and Kitsap counties. It's also to reduce the costs of healthcare through innovative and collaborative redesign of the healthcare system. And under MTP, the client care is going to become integrated, and the payment model will move from a fee-for-service to a value-based payment model. And there's a link here for anyone who is really dying to know more about MTP. A little bit of background on how we got here. Back in November of 2016, there was a regional health needs assessment that was conducted throughout our 3-county region. In March of 2017, that assessment helped define the areas of focus that our region chose to work on, which then helped us in selecting the 6 projects that we chose to participate in under MTP. There were 8 projects available, and the OCH region is completing 6 of those 8 projects. Back in April of 2018, we conducted the NCC, Natural Community of Care, convenings. And that is where partners signed the shared change plans. Many of you may have participated in those meetings and signed that shared change plan. In July and August of this year, we completed the PHBH, or Physical Health Behavioral Health Change Plans. And the first payments were rolled out to our PHBH implementation partners just a few weeks ago. And now that we are here in October, we are now doing the CBOSS change plan. So just some helpful definitions to go over as we move forward. The term implementation partner refers to a partnering provider organization within our 3-county region that completed the change plan and signed the implementation partner specific agreement, or also referred to as the contract. So we have our PHBH implementation partners, and now those of you who choose to move forward in completing a CBOSS change plan will become CBOSS implementation partners. As we move forward, when we talk about domain, focus area, outcome, tactics, start date, target date, I'll touch on those more in depth when we go through the CBOSS change plan so that it makes a little bit of more sense. So as I mentioned before, OCH chose to complete 6 of the 8 available projects, and those projects are listed here on the top level. They were bidirectional integration of physical and behavioral health through care transformation, diversion interventions, addressing the opioid use public health crisis, reproductive and maternal child health, access to oral health services, and chronic disease prevention and control. From there, instead of choosing to keep the 6 projects siloed and separate, OCH chose a more combined approach that we felt made more sense for the providers in our region, and incorporated all 6 of those projects into one physical health, behavioral health change plan that was separated into 4 separate domains. And those domains are care coordination, care integration, care transformation, and care infrastructure. From there, we use the PHBH change plan to inform the development of the CBOSS change plan. And the CBOSS change plan is split into 2 domains, and those domains are care coordination and care infrastructure. So this is just to illustrate for you kind of how the change plan is set up. So if you're looking at your change plan, in the far left column is the domain, and there are 2 of them for the CBOSS, like I said, care coordination and care infrastructure. Each domain is then separated into different focus areas, and then from there, each focus area is separated into different outcomes. Some of those outcomes are required, meaning that you must sign up for and complete all of those outcomes in order to complete a CBOSS change plan, and the required outcomes are indicated in bold. I will say I believe that all of the outcomes for the CBOSS change plan are required except for 3 which are not. Each outcome then has different tactics listed, and those tactics, some of them are highly recommended, and the highly recommended tactics are indicated with an asterisk and are indicated by blue font as well. So when you're completing the change plan, the outcome is what you're going to be focusing on. That is what the outcome that we're hoping to get out of you completing the change plan. There is not really an end to an outcome. It's more of when that outcome is fully implemented and when you can begin focusing on scaling and sustaining. And the tactics are just pieces of evidence-based approaches and other sources of information to help get you to that outcome. I believe most of you or all of you received the email from me on Tuesday in which we released the CBOSS change plan, and this is what the attachments, the many attachments looked like that were attached to that email. And I'm going to walk through those. So the first attachment that I hope you will spend the first bit of your time focusing on is the instructions file. Then we have the Excel file of the CBOSS change plan. And then here we have the 2 Word documents are the implementation partner specific agreement or the contract and attachment B to the contract. Then the remaining PDFs are some files that are intended to assist you in completing your change plan. These are not items that you need to do anything with or fill out and send back. They're there more for your reference and assistance. And I'm going to walk through how to orient yourself to those files. So the items, if you do choose to complete a change plan that you'll be sending back to us, is the completed Excel file of the CBOSS change plan and the completed contract signed. So for the instructions, like I said, we want you to read through the instructions file first, and we also think it's helpful to review the CBOSS change plan in its entirety in order to gain a full understanding of the potential scope of work that's detailed in the document. It might be helpful for you to review the listed outcomes and tactics to gain a clear understanding of what activities your organization is already doing, as well as activities that your organization intends to do, is interested in doing, or maybe is already doing, but you're interested in expanding or scaling and sustaining those activities. Like I said, the required outcomes are in bold, and any implementation partners must commit to fully implementing these outcomes during the MTP period, which, as I said before, is from 2017 through 2021. And the highly recommended tactics are indicated in blue and with an asterisk. The next thing we recommend you do is you review the PHBH change plan items for your particular NCC that you are operating in. If you're operating in more than one county or NCC, then we recommend that you review them for every NCC that you are practicing in, so that you can gain an understanding of how your scope of work under the CBOSS change plan may complement the PHBH change plan outcomes and tactics that physical health and behavioral health clinicians already signed up for. The CBOSS change plan, in order to really make the most impact out of the limited funds that we have available for our region, OCH did decide to link the CBOSS change plan with the PHBH change plan, and so the scope of work under the CBOSS is intended to be complementary to what the PHBH change plan partners are doing. When you fill out the change plan, you'll mark the outcomes you would like to choose as a part of your scope of work by marking with an X in the column labeled check O. And a note to keep in mind is that only the outcomes that you started on or after January 1st, 2017 can be marked. So if this is something that you have already been doing prior to January 1 of 2017, you'll mark the date that you started expanding on that or scaling and sustaining on that. You also can only select the outcomes and tactics that your organization is committing to specifically as a part of the MTP. So there may be items that you're doing in other aspects of your work that are not related to MTP that we would like you to not indicate if it's not intended as a part of your scope under MTP. For the outcomes that you select, we need you to specify the date your organization starts or intends to start this outcome in the column labeled start date. And then for the outcomes you select, you also need to indicate a target date, and that is the date your organization anticipates fully implementing an outcome. So it's not the date that you're done, because all of these outcomes are things we hope that will be lasting beyond the MTP period, but it's just when you feel that you are fully implementing that particular outcome. For each outcome you select, you'll also need to mark the tactics you would like to choose to assist in getting to the full implementation of the selected outcome. And in the column labeled check T, you'll just make a X or a check mark for all of the tactics that you might want to apply to that particular outcome. Certain tactics might have some text fields associated with them in the far right notes column, and you're asked, if you're asked to provide additional information, like some of them might say list partners, then we would like you to fill out those rows as well. So here's an example of the first page of the CBOSS change plan. So like I said, this is the domain column on the far left. This first domain is care coordination. This first focus area is population health management. And here we have outcome A. Organization participates in an NCC bidirectional referral network for at-risk subpopulations, and this outcome is bolded, which means it's required. So in this column, you'll check O, you'll need to put an X, indicating that you are committing to doing this outcome. You'll need to specify a start date, and January 1st, 2017 is the earliest date that you can put in this column. And then you'll need to put a target date, and December 31st of 2021 is the latest target date that you can put in this column, as that's the end of the MTP period. If you believe that you will be fully implementing this outcome before December 31st, 2021, that we would like you to list that realistic target date. You won't be held accountable if you miss a target date, like say you're going to do it in July of 2019, and July of 2019 comes and goes and you haven't gotten there yet. There's no penalty for that. It's just a way for us to be monitoring progress so that we can be assisting and providing resources and assistance if there are barriers that you're encountering, so that we can make sure that we are where we need to be at the end of 2021. And then here is a list of tactics. So tactic 1, you can see, is indicated with an asterisk and in blue, which means it's highly recommended. And so if you were selecting this tactic, you'd put an X in this column here labeled check T. And then here you see there's a drop-down menu where we would like you to check all of the subpopulations that you will be doing this tactic for. So you can see here, I've indicated I'm going to do subpopulation D, which is individuals with cardiovascular disease. I'm just now noticing that that's a typo. And then here in this far column titled Notes, you can see for each subpopulation, we're asking you to indicate the partners you will be working with on this, subpopulation. I'm going to go back. Any questions so far on this part, on completing the actual change plan and the mechanics of it?
Hey, Miranda, this is Susan Buell. Can you hear me?
Yes, I can.
Great. Just because this is all new and wonderful, might it be an opportunity to send you a draft and have you give input or questions before it's finalized?
Absolutely. So at the end here, you'll see that myself and Jury are available for one-on-one meetings, which we highly recommend anybody who thinks they will submit a change plan to sign up for a one-on-one meeting. And that's where Jury and I will travel to you, to your organization, and sit down and meet with you and go over your change plan in depth.
Great.
And that's the best way to go about this. But if that's not possible, then you're absolutely welcome to email me any drafts, and I'll be looking over them in depth and sending you any feedback or questions that we might have.
Thank you.
Any other questions so far? Okay, I'm going to move on to talking about those other helpful PDFs that were included in that email that went out. So this is an example of the first PDF, which would be, excuse me, looking at the, there are 3 of these files, one for every NCC. So this is for, this particular example I'm going to use is out of the Clallam NCC, but all of the NCCs are formatted in the same way, so the walking through it will be the same no matter which one you're looking at. But you'll want to look at your particular NCC you're operating in. And it lists all of the PHBH change plan implementation partners for that NCC. So these are all the people in Clallam NCC that filled out a PHBH change plan. And here in these columns at the top, they're listed as well. So for example, if we take this first one, which is the Bogachiel and Clallam Bay primary care clinics, and we can go down this column and we're able to actually look and see what of the, on the PHBH change plan, which is longer and I would say probably a little more comprehensive than the CBOSS change plan, but you can look and see all of the tactics that this particular organization selected so that you can see who you might be partnering with. So the way this is broken down is this light blue color here, care coordination, that's the domain. Population health management, like we saw on our last slide, that is the focus area. And then this little darker blue column here is the outcome. Population-based platform is systematically utilized to follow subpopulation. So that's the outcome, which we have not indicated who signed up for that outcome, but because you want to be focusing on the tactic level. So we thought that might just be one more piece of information that could be potentially confusing. But obviously, if someone has tactics listed here, that means they signed up for the outcome. So for Bogachiel, we can see that they signed up for the tactic standardized identification of and track subpopulations needing more efficient management because it's colored in. If it's blank, it means they did not select that tactic. And then here are all of the subpopulations that they indicated as well. So for Bogachiel, we can see they selected the subpopulations asthma, diabetes, and hypertension, but did not select cardiovascular disease, high utilizers of the criminal justice system, or experiencing homelessness and or food insecurity. So this is just for your information. It's just to help you say, you know, that you're going to be working on, this next one here, social determinants of health, and you want to see, I'm operating in Clallam County, what partners are doing which tactics, so I can be thinking about how I might want to be complementing the work that they're already doing and linking with what they signed up for in their change plan. So I know that Bogachil signed up for screening patients and clients with housing status and needs. If that's something that my CBOSS organization is interested in working on, I can see here who signed up for that, so I can think about who might be the partners in my NCC that I want to work with. Before I move on, are there any questions about the formatting or how to use this particular file? Or Siri and Phil, please feel free to jump in if I completely butchered explaining that. Okay, I'm going to move on to the next one if there's no more questions. So this next PDF, so like I said, the previous one, there are 3 of them that you received, and they'll be labeled by the NCC. And then this one is labeled OCH Partnerships, and that is another PDF file that was attached to the email I sent out. These files are also available on our website. If you lost the email or didn't receive one, you can also access these on our website. And this shows in the PHBH change plans, there's only one file for every NCC. They're all combined here at the top, so you can see these first ones, or this actually goes in alphabetical order, but we have Bogachil, which is in Clallam. We have Discovery Behavioral Health, which is in Jefferson, and we have KRC, which is in Kitsap. So they're all combined here at the top. And you can't see it in the snapshot that I took for the slide, but at the bottom of every page, there is a handy footnote that that indicates the names of all of these, spelled out, of all of these acronyms here at the top. So it's not an acronym soup for you. So again, this breaks it down by domain here: care coordination, population health management, that's the focus area. And then this darker blue is where we see the outcome again. So care coordination protocols, that includes screening, that is the outcome. Sign business associate agreements or equivalent. This is the tactic level. Oops, let me go back. Oops. So this is the tactic level, and the intention here is to see, just like you have in that notes column, a space to list the partners that you're going to be working with, the PHBH partners have the opportunity to do that as well. And this is just laying out for you who those partners are for every single tactic where they had to list partners, who was listed for each PHBH partner. So this is the top here axis is who completed the change plan, and on the left here is the list of who was listed, and then the colored block indicates where they cross. So you can see for this particular tactic, Harrison Medical Center, which is the hospital in Kitsap County, indicated that they would work with Benedict House to achieve this particular tactic. So this might be helpful, a helpful place to start as well before you start completing the CBOSS change plan, and look and see on this list partners list, is there a place where your particular organization was listed as already people are thinking about working with you, or is there a place where there's a gap where you perhaps were not listed to begin with, but you think you should be listed, and maybe these are partners you're already working with or you would like to be partnering more significantly with. So are there any questions on the mechanics or formatting of this file? Okay, and like I said, the previous file based on NCC and this OCH partnerships, this is not something you need to do anything with or send back to us. It's just for your information and to assist you in brainstorming as you go through completing the CBOSS change plan. So are there any questions on the instructions or completing the CBOSS change plan in general before we move on to talking about ORCA and contracts? Okay, I take everyone's silence to mean that I am very, very clear and my webinar is awesome. So moving on to talking about money, because that's what that's like money talks, right? So in June of 2018, the OCH Board of Directors adopted a Medicaid transformation payment policy, and this you can click on this link. I will be sending out this webinar to everyone who attended today, so that you can have a copy of this to also assist you as you move forward. So you'll be able to click on this link, or you can access this on our website as well, which outlined a minimum set of requirements for any implementation partner wanting to complete a change plan. So the takeaway from that is that any implementation partner, as outlined by the Board of Directors, must demonstrate the ability to impact a minimum set of change plan outcomes and benchmarks. And that's reflected in those required outcomes. So the requirements to complete a CBOSS change plan is, as I've touched on before, is they must be aligned with the physical health, behavioral health change plans in your NCC. All of those required outcomes must be signed up for, and some of the tactics are highly recommended, but they are not requirements. There might be instances where you see an outcome and maybe none of those tactics that are listed there you feel apply to you. There is an option on a case-by-case basis if you're finding yourself in that bucket, where we can talk about other options and you could write in a different tactic if you have other ideas. We don't want completing the CBOSS change plan to feel limiting. Talking about ORCA, we do ask that anyone who completes a change plan will become registered in our online platform, which is the Olympic Reporting and Community Activities. There is one per NCC, so if you're operating across multiple NCCs, you will be a part of multiple NCC communities. This is where you're going to access information regarding the change plans and all things MTP in the future. It's really helpful, so even if you're not thinking about completing a CBOSS change plan, I do recommend becoming a member if you're an active participant in the NCC convenings, or even in 3CORE, which is our opioid response project that Lisa Ray Thomas runs. This is a really helpful online platform. So if you would like to become a user, you can just email me and I'm happy to send you an invitation to join. One-on-one meetings with myself and like I said, our clinical transformation manager, Jeree June, and your organization to review your change plan in depth are available. In the email I sent out the doodle poll. There is one doodle poll for Clallam and Jefferson counties and one for Kitsap County. So just if you're operating across more than one of those, just fill out the one that will be the location you would like us to meet you at, and we will get those scheduled. I'm hoping to start scheduling those meetings on Monday, since our timeline for completing these is a bit tight, and we want to make sure that everyone who wants a meeting has the opportunity to do that. Less ideal, but also an option if you aren't available for an in-person one-on-one meeting, we can do a GoToMeeting or on the phone. Any way we can work with you to assist you with any issues, concerns, or questions you might have, we're happy to be available. So the signed change plan, or the signed contract and the completed CBOSS change plan is due October 23rd. And we are anticipating the first payments to the CBOSS implementation partners who complete the change plan and sign the contract will be on November 16th, 2018. Any questions about the contract or payments?
Actually, I think I have something to add there. One thing I do want to note about the contracts, so attachment B that we call the FE Click agreement, that's something that every partner will have to complete when they sign up for the FE portal that the payments go through. And we don't have any leeway to change the wording in attachment B. They're kind of boilerplate languages that the HCA and the administrators of the FE portal came up with together. However, if you have any questions or concerns about the main contract that we sent over, the implementation partner specific agreement, then you can go ahead and send them to me or Miranda. Obviously, we work really closely together. So wherever you have a question, you're always welcome to send them in. Yeah, that's all I have to say about that. Thank you.
Okay, and I did see a question come in the chat box about, is there a way to know what to expect as a payment for 2018, 2019, which is a fair question. I think that's probably what's on everybody's mind. What I can tell you is that I can tell you the total amounts. It's probably better if I send that out in an email just for the sake of doing math on the fly, but there are total allotments for every NCC, so the payments are broken down by NCC, just as the PHBH change plan partners payments were, and the payment will be largely based on how many partners in each NCC participate. So there's not really a way I can tell you what to expect as a first payment until we know how many partners are choosing to participate in completing a CBOSS change plan. The funds flow for the CBOSS is being finalized, and it will be presented to our board of directors on Monday, and then we'll be following the board of directors' potential approval of the funds flow. We'll be able to release what that funding is going to look like a little more in depth. But just as with our PHBH change plan partners, we can tell you what the total pot of money is for each NCC, but as far as what each partner can expect as a payment, that largely depends on how many partners choose to participate. So if you have questions, concerns, comments, we are happy to be available and assist in any way that we possibly can. Like I said, Juri Jun is our clinical transformation manager. Her contact information is listed here, and my contact information is also listed. And Juri and I are available to do those one-on-one meetings. So please complete those doodle polls this week if possible, so I can start reaching out to you on Monday to start scheduling those meetings. Any questions you have about the contract, I'm happy to take any of those questions, but I will just be passing them along to Maggie, so you can send them directly to Maggie as well. So we have breezed through this rather quickly because there weren't a ton of questions, so I just want to make sure we give one last opportunity to answer any burning questions that you might have before we end. Okay, well, Thank you, everybody, for your time and for attending and your continued commitment to this important work. We really do value the important work that you're doing in each of our communities. So if you are interested in participating, please complete the doodle poll, send me any questions that you have, and you will be hearing from me on Monday to see if you are interested in scheduling that one-on-one meeting. And I will also be sending out these slides to everybody via email later this afternoon, so you can look for those as well. But I just want to thank you for your time and for attending.
Thank you. Thanks, ladies.
Thank you.